everyone, we're going to do an example of a head to toe on a patient. You come in, you're going to wash your hands. I'm going to simulate a lot of these things just so you have a general idea. Introduce myself, my name is Allison. I am your student nurse.
Hi,
Can you give me your name, date of birth?
I'm Sharon Koya, 4/15/1963.
So you are going to pull your curtain, make sure you have privacy. How are you doing today?
I'm fine, thanks.
Are you having any pain?
My stomach hurts today.
What would you rate it on a scale of 0 to 10?
Probably a 6.
A 6. Is it aching, sharp, burning, stabbing? How would you describe it?
It's kind of sharp, especially when if I'm trying to lean over or walking.
Did it just start or have you had it for a while?
It started last week.
Okay. Is the doctor aware of this?
No,
Okay. Have you had anything for pain?
just Tylenol.
So when you do your pain assessment, you're going to find out where it's at, what the type of pain, and the duration. So since it started last week, it's going to be a long-term pain. It's not a sudden onset. You're going to put down the scale, so a 6 out of 10. You have to document that you followed up with your nurse, and then 30 minutes later, you're going to say you come back and reassess the pain. If you are the nurse, then you're going to see what pain medicine they have available, give that pain medicine, and then follow up 30 minutes after you give your pain meds. I always come in and ask how they're doing and what their pain level is to start with, so you have your general to begin. Right when you walk in is when you're going to start your assessment. So you see, is there anything major going on? Is there blood pooling anywhere? Is there facial drooping that wasn't there before? If you're new for this patient, you have no idea. If it wasn't a report and you see facial drooping or you see a lump on her forehead, you're just looking for any abnormalities that you didn't see before. Notice the hair, the skin, you're just doing your quick look when you come in. I'm going to start head to toe. That's typically how I do my assessments. So I'm going to start with neuro. She said her name. She knows who she is. Do you know where you are?
Yes, I'm at the doctor's office.
Okay, so she is not alert because we're at Valley College. So she would, do you know what day it is?
Thursday.
So it is Thursday, so she would be A&O times 2. She is not alert, or she is not oriented to place, is how you would document that. Any dizziness or headaches today?
No.
Okay, I'm gonna have you look at my pen light. This is not a pen light, but you would take your pen light and you come across, make sure you have her look at you, make sure that the pupils react. You're looking for perla, follow my pen. You're looking for accommodation. Very good. Any dentures, contacts,
Contacts.
glasses at home,
At home.
hearing aids?
No.
Okay, so you want to make sure if she has anything extra, you're going to chart that as well. Go ahead and smile. Stick your tongue out. Remember, that's your neuro check. You're looking for any drooping, any weakness on one side. Then I do my neuro check at the same time. I'm going to have her squeeze my fingers, and it feels equal on both sides. Thank you. Then go ahead and push down on my hands. Good. Then push up on my hands. There you go. Perfect. And she was equal on both sides. So you would chart that. If she's weak on one, you'd say weakness, slight weakness, or moderate weakness, or a lot of weakness on one or the other side. Then I'm going to take my blood pressure cuff. I'm going to get my blood pressure. Once that's done, you're going to put your stethoscope on and you're going to do your lung sounds. I start from the top to the bottom with my stethoscope. So you're going to put it, I usually put it over top of their clothes. If you can't hear it good enough, then you can go underneath of their gown or their shirt. Take a deep breath. You want to listen to one full inhale and exhale. Obviously your stethoscope will be in your ears. I'm just demoing. So I listen to 2 in the front. If they are clear, if you hear wheezing here, you're gonna document what side you heard the wheezing in. And then same thing, you would do 1, 2, 3, 4, 5, 6. Remember, when you do the back, go ahead and stand up. Your lungs are like this to the side. So you're gonna 1, 2, 3, 4, 5, 6. You wanna make sure you get down in those corners, because if you have just a little bit of fluid, they're gonna hang out in the bottom of those lungs. Are you having any shortness of breath?
No.
Any cough?
No.
If they do have a cough, find out if it's dry or moist. If it's moist, are they bringing anything up, and what color is the sputum? Since you're here, you're going to go ahead and listen to the apical. You're going to listen for 1 full minute. If you can't find it here, remember there's 1, 2, 3, 4, 5 spots that you can find the apical pulse, and I have found it all the way under here before. It just depends on the position of the heart. So if it's irregular or regular, you're going to chart the number, and then if it's regular or irregular. Next, I go to the stomach, and you're going to do the upper right, upper left, lower right. While I'm doing this, I'm pushing with my stethoscope, and I'll notice if she's reacting, if there's any tenderness. And a lot of times I ask, is there any tenderness, any soreness? Do you have any diarrhea, constipation?
No.
When was your last bowel movement? You don't actually have to answer that.
Yesterday.
Are you tolerating your food okay? Any issues eating?
I've just been hurting lately now that
Okay, you're a little sore.
Yes.
So what area when I push on it hurts? Is it the bottom down here?
Kind of clear across.
Okay. So you would chart that she is a little tender in her, you could say LLQ for left lower quadrant and RLQ for right lower quadrant. So we asked all our questions with head, lungs, check the heart, check the abdomen, then you're gonna wanna finish your vitals. So I check if she has her radial pulses, if her peripheral pulses are palpable on both wrists, and they're warm, and they look like normal skin color. Then you're gonna check your turgor. So you pinch the skin. If it stays tented for more than 3 seconds, then they're a little dehydrated, and you document patient has tenting greater than 3 seconds. Same with the capillary refill. You're gonna press on that capillary bed and see if it, what's the word for that? If it blanches. Yes, and if it comes back in greater than 3 seconds, then you have to document that as well. Moving on, so you did the cap refill, you checked her skin, you come down to your extremities. So I check everybody's ankles. You can wear gloves for this if you'd like, but usually I always squeeze the skin or pinch the skin around here, make sure there's no edema. I check the skin if there's any dryness, any cracks. If you're doing a full intensive head to toe, you're gonna wanna check all the skin. She has no edema. A lot of times I'll pull the sock down. If there's a deeper line, then they'll have a little bit of edema. And then you check your pedal pulses, which remember is between that first toe and second toe. You go up to the instep, check that pedal pulse. If you can't find the pedal pulse, then you're going to document unable to palpate pedal pulse. Skin color is good and warm to the touch. It looks like it's perfusing, but you'll say unable to obtain pedal pulse. And then you get your temperature, your pulse ox, and I think that's everything. After you're done, make sure you wash your hands since you assessed your patient. Make sure that if they have anything, you undo your privacy, see if she needs anything, and then follow up on that pain, the abdominal pain. Good?
Thank you.
Yep.